Hello and a very warm welcome viewers. You're watching the brand new edition of India Fights Back with your host Kriti Mishra. The Union Health Ministry has declared the Delta plus mutation of the coronavirus disease a variant of concern. In India, 16 of the 22 cases of Delta plus variant have been found in Ratnagiri and Jalgaon in Maharashtra and some in Kerala and Madhya Pradesh. The Delta plus variant has been found in the US, the UK, Portugal, Switzerland, Japan, Poland, Nepal, China, and Russia besides India. Viruses mutate all the time and most changes are inconsequential. But some even harm the virus. But others can take the disease more infectious or make it more threatening. And these mutations tend to dominate. So let's find out why this one is an area of concern from our experts. And joining us on the program today, Professor N.K. Ganguly, former Director General, Indian Council of Medical Research, and Dr. Sunil Raina, Professor and Head, Community Medicine, Dr. R.P. Govt Medical College, Tanda in Himachal Pradesh. Welcome to Sunset TV, both of you, and thank you so much for joining us. And Professor Ganguly, coming to you first, what makes the Delta variant so worrisome and specifically the Delta plus variant?
What happens, that the India always had its own variants, whether it was polio, whether it was bird flu, whether it was HIV, like it had C clade of India, not C clade of Africa or China. So it had always got mutations which were special to our population. We have about population and everything, right from Polynesian to African to Indo-Aryan, Dravidian, we have a cauldron of the different ethnicities within our country and with the nutritional challenge. So the virus, as it goes to the host with the host special dispensation, particularly if the host is a little challenge itself with other tropical infections and microbiota, it gets mutated. All mutations can't establish themselves. Some mutants, they fade away. Some mutants, if they get a opportunity, they enhance, and some mutants establish themselves globally. So the Delta, one of the first mutant, the British mutant established itself globally, but the vaccines worked in that. Pfizer vaccine works 86% in that, and there was not much concern in the severity of cases, although transmission increased. The South African and Brazilian variants were little worse, but they didn't become as much global as the British variant came. But then came Indian variant. And in Indian variant, the first variant was 617, then 617.1. Both of them actually faded away. And 617.2, that became the virus of concern because it established itself and it started spreading around the world. It also then got one more mutation. This mutation is known as K1417N. This mutation added to this and it became the Delta plus mutant. So this became really face of concern because Delta itself has gone, as you have said, that Russia showed a surge. Russia had got almost fully vaccinated. About 70% of its population has got vaccinated. Even then, the Delta variant, when it went there, it caused surge. The Britain, it has the areas where it has got vaccinated, it went for a small surge. So the areas which had got vaccinated, it got surge. The other problem which arose was that the AstraZeneca vaccine, which is being used in our country, the first dose only shows 40% of protection against this, against the Delta variant in Britain. And a small study with the Delta plus variant and this in Britain has shown that there are more hospital admissions. This is a small study, but this is one of the first very well worked out study where they have shown that there is more hospital variation. So it has really become a virus of concern. It has moved to 90 countries around the world. It is starting its own surges And in India, you have named the states. All these states have got a few common characteristics also. And in India, they move if the hazard index is low. Like in Wuhan virus, the L strain, the hazard index was low. They almost sealed it up. In
Yes.
India, hazard index is always high because there is a lot of movement through migrant laborers to others from one state to other, as well as Indians are around the globe and they somehow they end up coming and going. So in such circumstances, and with this that even the regenerate antibody doesn't neutralize it well, the vaccine works much lesser, about 60%
Right.
with the Delta variant. Delta plus we don't know. It really is a virus of concern. We need to really trace it, track it, and find much more meaning out of it and create new data on this.
Absolutely. We need more data. We need more studies on this and more evidence. But before we talk about the vaccines, Dr. Raina, help us understand whether this mutation can escape the existing treatment and testing methods. Do we have any data on that?
Kriti, first, thanks for having me. And this is the most important question at this point in time, whether this will escape the present treatment protocols as well as the vaccination that we are having at this point in time. If you look at the data is very small. Some studies you refer to as 22 cases, some talk of 40 cases that we have in India. Of the 28,000 samples that we have submitted to the world body for genomic studies. So the numbers are very, very small to really drugs, or this is the impact of therapeutic interventions, or for that matter, this is the impact of vaccines. Now we just need to build a perspective into it. Where does Delta plus fit into our scheme of things? Now, as you rightly pointed out, it is about whether it is more transmissible, more infective, whether it is it's more severe in terms of its killing power, whether it becomes the most dominant virus in future to lead a surge of pandemic in India, which I don't think will happen at this point in time. But more importantly, whether it will respond to the vaccines and the therapeutic interventions. But more important than all of these points is whether this vaccine whether this strain is resistant to the public health measures or public health interventions that we have at this point in time in place. So at this point in time, I don't think that the interventions that we have at this point in time is not going to be effective against this strain. So I keep saying, so if you have good enough vaccines which can take care of the virus strains which are coming up in future, but also the appropriate measures that we are using in terms of COVID appropriate behavior, the better masking that we need to use, we may be at a better advantage in tackling these strains. At this point in time, the numbers are very small to tell us whether they are going to evade or escape the vaccines or the drugs. But despite the fact that the numbers may be small, the variants will come up today or tomorrow. The virus has to mutate. So unless and until they take a toll on our public health interventions, we should not be very much worried. So as long as our public health measures are going to be able to take care of this, we should be staying pretty happy on this. And that's something that I feel confident about. Our public health interventions are rightly in place to tackle this.
All right, so public health interventions right now are placed well to tackle this. But I'd also like to take the views of Professor Ganguly on the vaccines. Sir, how are vaccines likely to fare against this Delta Plus variant?
Like one of the things which has already started, that now in some countries the vaccine data is now available for nearly 9 months to 10 months, and at this time for the original Wuhan strain, the immune responses are staying. But there is a percentage who do not get the appropriate immune responses. Many famous people in India are come in that particular category, even after taking 2 doses. So a third booster, it is known as sub-immunization. This is done for many things. A booster is being planned. The booster doses have already started in the Western countries. In India, the application for booster has gone. So there should be a booster which will build up immune responses in those in which the immune responses were poor. Mark you, our vaccines were at best 70% efficient. efficacious. 30% in any case didn't get enough antibodies. So a sub-immunization dose will be needed in the form of a booster. Third, the second strategy which has already started, the Pfizer, Moderna, even the AstraZeneca and Johnson and Johnson have created the third generation vaccine. These are made around the mutant. In the most respiratory infections, you give a 2-yearly or a 1-yearly vaccine, which changes, the strain change. And the WHO declares these strains according to the molecular epidemiology data and the global epidemiology data. And the coronavirus is a global infection at this given moment. The variants which ultimately are emerging, they are becoming global. And when they are concerned, viruses of concern globally, the companies are creating those structures right now. And in some, the trials have already started also in the different countries. So here, that will be perhaps one of the solutions. So we should be having third generation vaccines, second generation or third generation vaccines, which are on the anvil. We also need to really very closely study the global scenario, because as you have stated, that whether Delta variant is now a global infection. And there are more than one vaccines which are being used globally in different countries. Many of them have ethnic Indian population. So we really need to look at those data and make our own thinking around those, and think at least one step ahead. Two more things I would like to say shortly.
Yes, sir.
One of them is this, that we need to have our molecular surveillance much better, because only then we will be able to do it. The GISAID has got now 200,000, 300,000 strains from the globe, including Indian strains. So if we are not sequencing that much, many of these samples are with the GISAID also, because many of our partners have joined GISAID. GISAID is one of the organizations which I was fortunate to be a first founder member. It started with influenza, H1N1 and H5N1. It is now one of the major COVID source. So we should study very closely about this, do modeling, and should be able to predict through good GIS, Geographical Information System, that where these niduses are coming up and take preemptive action on that. And finally, we need to vaccinate. This will be a very major vaccine challenge. We will have to vaccinate pregnant women. Some of the vaccines can go to pregnant women right away. We should import them and give to pregnant women, because if they get infected, child get affected and the pregnant woman has much more chances of dying. We need to also see that children, if we really want them back to school, because in the school, the other thing is that put heavy funding in the school. So have small classes sizes, have more ventilation, have more PPE and sanitation, and immunize the teachers. So we have to look at that. Children go to schools, they become, their cognition becomes better, they get their midday meals. So we need to have an entirely new vaccine policy, which should be a dynamic, generic and flexible. We should be able to move it, enhance the access in ethics and equity based thing. Large number of Indians do not have good access to any of the goods which are meant for them. We should move the vaccine to closest part of them, remove their fears and hesitancy, and vaccinate them.
Yes, sir. But you also made a very important point about booster shots. Dr. Raina, what is your take on booster shot, its importance against this Delta Plus variant?
Now, again, if you look at the things in the perspective, do reinfections happen? Yes, they do happen, despite the fact that we may be vaccinated. What we call as breakthrough infections. Even after getting infected once, reinfection does happen. So reinfections are a norm at this point in time. They do happen at some point in time, as also the breakthrough infections in people who have been vaccinated. And this may continue to happen in future as well. If you are comparing this coronavirus or COVID-19 with the way flu has been panning out, the influenza disease has been panning out across the world, then yes, we will need the booster vaccines, because that's how the flu pandemic behaves. That every year you pick up 3 or 4 most popular viral strains that are there in our vicinity and develop vaccines against that. But I'm not convinced at this point in time of thinking of booster vaccines, because of the fact that vaccine is something which is in very short supply. If you are looking to vaccinate everybody in India in next 5-6 months, we will need around 180 to 190 crore of doses, which is something that is not going to happen. So unless and until we vaccinate everybody in one go, then only can we think of going for the booster vaccines. So boosters may be needed once we are able to vaccinate everybody. And for that, we will need to stream up, we will need to boost up our supplies as well as be able to vaccinate everybody. So at this point in time, we are not thinking of pregnant females. We are not thinking of kids. We are just focusing on everybody above 18 years of age. And we are not able to meet the demands of this huge population. So once we are able to do that, we may be able to think of boosters. Now, we again need to think about this in terms of the fact that what do these vaccines do? So whatever the variant has been, the Delta variant is something that has been studied in detail more than the Delta Plus. The numbers for Delta Plus are very small, but Delta has been studied in detail. And most of the vaccines across the world have been saying that the vaccines that are there in the world at this point in time, whether they are the Pfizer, the Moderna, the Covishield, or the Covaxin, all of them, after second dose of vaccination, are able to prevent severe disease. So deaths are the ones which are is something that is saved by or prevented by this vaccination. So if we are focusing at preventing deaths at this point in time, then all of these vaccines should be given in 2 doses as recommended by these vaccine agencies. So that is something that should be the target at this point in time. Vaccinate everybody as soon as possible, give them the required number of doses so that we are able to prevent them from severe disease. If you are looking at preventing transmission, so that is the second part of the vaccination. At this point in time, the vaccines that are available with us are not sterilizing vaccines or are not the vaccines which are going to prevent transmission. They are the vaccines which are going to prevent death. So yes, if we want to prevent transmission using these vaccines, that may not be an effective strategy. So using a booster, thinking of it being an effective model of preventing transmission, again, may be something that we need to think about. So my focus or my takeaway on this point in time is vaccinate everybody as soon as possible with as many as doses as required by the particular vaccinating company or vaccinating agency or vaccine policies. So that is something that needs to be taken care of. And maybe we need to strategize vaccination. Say, for example, if you are thinking of vaccinating anybody above 18 years of age, who should be your priority groups to get the vaccination first? For example, if you want to open shops, the shopkeepers should be the one to get vaccines first. If you want to open up hotel industry, the hotel industry people should be the one to get vaccines first. If you are asking people to move around, travel is something that is going to be the major or the key player as far as this pandemic is concerned. So if you are allowing people to travel from one place to another place, ask them to go with a vaccine passport, allow them to carry their vaccination certificate. They should have 2 vaccines, then only they should be traveling. So this is something that may be needed in next few weeks or few months of time.
Absolutely. So it's going to be very important how we strategize. But another area of concern, of course, is of third wave. Professor Ganguly, what are the odds of Delta Plus variants sparking a third wave in India?
Actually, if we are able to vaccinate, like in another 2 months, when we are getting the vaccine production boost, and the Zydus Cadila is getting the go through, the Baylor's vaccine is getting a go through, Novavax is on the verge of getting a go through. We will have multiple 5, 6 different. Sputnik already has got go through. So we will have about 5, 6 vaccines. In 2 months, the vaccine situation is going to improve. And in these 2 months, by December, our plan is to do the effective vaccination. You have seen now this, and when the central government took up the responsibility of procurement and providing vaccines, you have seen now that a very large number got vaccinated. It is not very uniform at the moment, and if it becomes very uniform, the vaccination will happen. And at this given moment, the data which is there, we should not be disillusioned that if you don't give second dose, you are not protected, period. And second dose, not many people have received. So vaccination at this given moment, since we have opened up 18 to 14 and we have started trials in children and others, and we are in a hurry to open the schools, we will have to strategize in a way in which we are able to fill these particular slots very strongly. And so Delta plus vaccine at this given moment, if there will be some escape mutants when you vaccinate, we have to very closely monitor them. And when I was talking of booster, I was talking of booster planning right away, doing the trials with the boosters, so that when you need them, when you have vaccinated and if you have a need, you are not caught napping, and you are able to deal with that. So that is the research which is happening around the world. And some of our companies, like our company Genova, which is making a messenger RNA vaccine, is starting now. One bad news is this, that one of the German companies which has made, which is known as CureVac, which made the messenger RNA vaccine at this current moment because of this these Delta and other strains, because all others, when they happened up to the British mutant, they had to handle. This one, when it went to multi-country, it didn't do that well as the Oxford and other vaccine trials have done. So the new set of vaccine trials which are coming, we need to observe very closely, and our research should be able to protect us in the future by getting ready with the new strategies, if needed new vaccines, if needed timely booster, and now few drugs are also coming up. Molnupiravir, which actually kills the virus in second day, about 90%, have started its trial in India. It's an oral drug, although window is again small. There are 2 or 3 antibodies which have made in India, Fab2 fragments, which have started trial in India. So the scenario is fast changing, but we need to really come with policies, the structures, infrastructure, capacity to seize those opportunities, and planning, very good planning on the drawing board. So I don't think, I don't see this happening, but 2 events are happening. We need to closely watch that. One is the Olympic in Japan. Japan is very poorly immunized. Every person from the world will be converging there. It will be a cauldron where viruses will mix. So this is one event which we need to look, and we have to observe for next 2-3 months, because if the surge comes, it will come in 3 months' time. So we need to look at these next 2-3 months very closely and very smartly unlock. We should not suddenly unlock everything, and people's behavior we need to control. It's very difficult to control, so that in these 3 months, next 3 months, we do not become totally reckless and then have the. If we are able to do that, we may prevent the surge.
So 2 very important points that you made, that we have to smartly unlock, and also the fact that we have to follow COVID appropriate behavior at all times. That is non-negotiable. On that note, thank you so much for joining us, Professor Ganguly and Dr. Raina, on this show. Well, viewers, that's all we had for you in this edition of India Fights Back. But before that, let me remind you once again to stay safe from the coronavirus pandemic. Remember to wear a face mask and wash your hands and face regularly. And ensure that you maintain physical distancing whenever you're stepping outside. Remember, these simple precautions are all it takes to defeat this pandemic. Take very good care and goodbye.